harm reduction actually saves lives. Harm reduction should be 7 days a week, 365 days of the year. It tries to work with the person rather than telling them what needs to be done. It needs to be on the individual's own terms. My name is Mary Varghese. I'm the Executive Director of the AIDS Program South Saskatchewan. I've been the Executive Director since 2019, but I've been with the organization since 2015. So we are frontline community-based organization for STBBI prevention. We work with people living with HIV as well as marginalized populations at risk of HIV, hepatitis C, as well as sexually transmitted infections. There are various factors that bring people to using substances. The mental health challenges, the homelessness, and injection drug use in Saskatchewan is one of the primary drivers for HIV transmission. Harm reduction is actually a set of rules or a set of strategies that people can do so as to minimize the negative consequences of risky behavior. It can be as simple as wearing a helmet when you're riding a bike, or wearing a seatbelt when you're driving a car. How you can prevent an overdose, getting tested so as to prevent the transmission of HIV, or knowing their status so as to prevent the transmission of HIV. That is harm reduction. APSS runs a very active needle exchange. We see about anywhere between 90 to 100 people per day. We also have a reportneedles.ca. We started in 2021, and we've been collecting needles through our reportneedles.ca website. Anyone can report the discarded needles in the community by going onto the APSS website or by doing a search on a web browser. The Report Needles, it also tells people about how to deal with discarded needles when they find it, so that if they feel comfortable, they can do so themselves. APS has distributed over 654,599 sterile needles in fiscal year 22-23. We also retrieved over 522,000 used needles from the community. It's a complex problem, both this opioid crisis as well as the HIV epidemic, and that needs to be addressed in order for us to have any kind of impact on the transmission of HIV in Canada. This World AIDS Day, let communities lead. It ends with us.